everybody, my name is Megan Griffith. I'm the co-author of Recovering from Mental Illness blog here on HealthyPlace, and today I want to talk about medications in recovery. So medication is usually a really charged topic because it has a lot of stigma attached to it, but the truth is medication is a huge part of recovery for a lot of people dealing with mental illness, including myself. I've been on medication for a long time, I think 6 or 7 years now, and the medications I've been on have changed throughout that time, and recently, as in like yesterday, I started a brand new medication that I've never been on before. So I have just been thinking a lot about medication and its role in recovery and how we deal with the stigma surrounding it. So I just wanted to talk about that a little bit because I know there are a lot of people out there trying to cope with that themselves. One of the biggest sources of stigma in my life doesn't directly come from the people in my life. It comes from things they've said in the past that are now sort of ingrained in my head, and now I tell them to myself. So it's repeating that stigma that we were told when we were younger and we didn't think anything about, and now it's stuck in our heads. So, for instance, a lot of times in my head I'll hear, do you really need that though? Like, when are you going to get off this? Like, what's your exit strategy here, basically? And that's so frustrating because in the moment when you need more medication, and I need more medication right now, you don't have the capacity to think through an exit strategy. That's not what medication is about. It's not about being on it for the shortest amount of time possible. It's about feeling better. It's about recovering. That's what medication is for. It's for improving your quality of life, and you can figure out when and how to get off those medications later when you're feeling better and you can think more clearly. When you are super depressed, that's just not something you're going to be able to figure out on your own in that moment. Plus, a lot of psychiatric medications are meant to be taken long term. They're like blood pressure medication. You don't get off that eventually. You take it because you have a problem with your blood pressure. And honestly, psychiatric medication is the same way. You take it because the chemicals in your brain are not being produced correctly. Sometimes therapy or other like coping mechanisms can help enough that maybe you don't need medication or don't feel that that is a good part of your recovery journey anymore. But there's also no harm in taking medication forever because that's sometimes just how our brains work and what our brains need in order to be healthy. So these are some things I've been telling myself lately as I embark on this change. Changing medications is always stressful. You worry about side effects, you worry about an adjustment period, and then you deal with all that stigma in your head too. So these are some things I'm telling myself and telling you as well. So if you've had some issues with medication stigma in the past, or if you're changing medications now and you want to commiserate, feel free to comment below.